Hi, I'm Dr. Malcolm Ware. I'm one of the principal partners of the vet practice in Whittlesea. We're also known as COSMA, Canine Orthopaedics and Sports Medicine Centre Australia. We're a 14 vet multimodal practice with a very large rehabilitation and sports medicine wing. For that reason, we use a lot of laser therapy in what we do every day. We found that it dramatically speeds up wound healing and it aids us in pain control in all post-surgery applications. With our cruciate surgeries, for example, and we do TPLOs, CBLOs, the laser would be decreasing our healing time by 2 to 3 weeks, decreasing our necessary rehabilitation time by in excess of a month compared to pre-laser. The dogfight wounds come in where the dog's muscles have been torn apart, they're contaminated, and then often you'll stitch them and they break down. We laser them. What that does, and what we've noticed, is that it actually gives us cleaner wounds and it increases the viability of the wounds when we stitch them back together. We get decreased amount of breakdown by treating these wounds with laser therapy before we take them to surgery. We see a lot of dogs that have been diagnosed with iliopsoas injuries, treated with rest and either anti-inflammatories and painkillers, and these dogs are still not getting back to work. What we found is that by applying laser therapy over an extended period of time, we are able to get these dogs back to functioning and being able to do their sports program again.
So we've used it on cats. Cats absolutely love it, particularly spine for them. Cats definitely go undiagnosed with their spinal conditions and they love it. It's just like lying in the sun for them. We have a lot of IVDD dogs and post-spinal surgery dogs that we use the laser for. The results you get from it are amazing. Owners are having trouble with financially affording to do rehab and laser and everything. We usually cut it back down to lasers because it's something that we can do and obviously the owners can't do at home. So we often teach a lot of exercises and then just have patients come in for laser. It's really compact, easy. You can pick it up and take it anywhere with you. You don't have to talk through settings. You can actually, it's all pre-planned and pre-organised in there, as well as having your attachments for dental and for ears. We've used a lot for dental disease in dogs and for chronic ear infections as well.
Seeing some of the chronic ear infections that medication and cleaning hasn't been able to resolve, and a simple laser once a week and sometimes getting it out to once a month. And they're so much more comfortable. Owners don't have to go through all of the crazy cleaning regimes that most dogs hate and can become quite aggressive with sometimes. So I love seeing the geriatric dogs being on multiple medications and being able to reduce them severely, or even sometimes even get them off medication 100%. That's amazing, seeing their comfort levels and the way that they enjoy the laser therapy as well. Most of them will relax, some of them will go to sleep. We have so many people that end up at our clinic because they have friends or family that have come here and seen the results that just laser therapy alone can have on their comfort levels. It's really easy to be able to talk your client into using laser therapy to treat these conditions because the long-term effects of using something like laser therapy usually highly outweigh having to make multiple trips to changing medications and doing all these revisits. So something as simple as being able to come in and see one of your nurses that is trained in laser therapy to see these patients, it becomes quite cost effective for the clinic and for the owner as well.
We don't charge a lot for it because using class 4 laser, most of your therapy sessions are so short in time that you can basically charge a laser session out from $25 through to $50, and that's a very easy number for clients to pick up on at the end of a surgery. In our practice, we train our nurses to do it, so the vet's making a suggestion, it's part of the treatment plan that is developed by the vet, but either our surgical nurses, our patient care nurses, or our rehabilitation techs perform the procedure. So it frees up more time for the vet, but it increases your quality of patient care. We have 3 lasers within the practice, the most recent being the K laser. With my last purchase, the reason that I changed to K laser was due to its compactness of size. Very easy laser to take anywhere within the practice. The programming of it is very easy to use. The control panel that comes with the K laser, it's very easy to teach the nurses what setting to use for what particular condition. But we also have the ability to choose our own settings. From a business model point of view, I think it's probably one of the fastest return on investment pieces of equipment that I've ever bought. They are significantly expensive to get a good laser, but because of the frequency of use, the return on the investment is actually very fast.